please spare no detail. uh, let's start with the beginning. Can you tell us about your life story? Where does Yolanda come from?
Okay, well, I'm Yolanda Chacon, born in Amaniday Chacon. So I was raised here in Delano, and my mother was a farm worker, and she worked in the fields with Helen Chavez, Caesar's wife. When they went on strike, they left the fields from DiGiorgio. That was one of the first companies that got one of the first contracts as well, because they signed all the contracts. So when I was 7 years old, I went on my first march in 1966, and with my mother and my tias, and it was a family affair. We were all involved, as my mother's sister, Sally Chavez, was married to Richard Chavez, and they had Chato, Freddie, Dorothy, Susie, Becky, and Luby, 6 kids. And so actually my uncle Richard is the one who built this building here, designed it, and the clinic, and the 40 acres, and the gas station.
Yeah.
My aunt used to have a little model in her home. So they actually put their house, took the money, a loan out of their house in order to start this project. So when I grew up and we were on strike, every Friday we went to the Filipino hall, to the strike kitchen. And so we would have dinner there. Either our Filipino brothers would make dinner, or our Latina mothers would make dinner.
Yeah.
So we would have the meetings. All of us were always there, the children. And Caesar, Dolores, and Larry Leon would be up there, and Brother Pete Velasco speaking about what was happening in the fields. I used to go, my mother was on strike, and sometimes as I got older, I would go with her. And during the time that the Teamsters were partnering up with the growers, and the sheriffs were against us as well. So there was a lot of violence in the fields, and I witnessed that. And as I was growing as well, I would go to the Safeway boycott here locally when we were on the grape strike. So I grew up in the movement, and before we even had the 40 acres, there was like the little pink house over there. And since our parents were in the fields all day long working, striking, we had what we called like an alternative after school program. It was called a Huelga school. So we had volunteers, like when Dolores and Caesar would go speak at universities, they would tell young people, if you want to make a difference, come to Delano, we need you. And so some would come, and some spoke Spanish and would help and be organizing, but some didn't. So they worked with us, and their job was to pick us up after school, and we would go there. They helped us with homework. And in the building, it was right over there by where now the the Casa Hernandez, the senior citizen housing project that the United Farm Workers built. It was across the street, right in the corner, the little pink house, the Huelga school, and then the house where the people who taught us, Gordon and Felicia, lived with their children. So at that house, we had the mural of Pancho Villa, Benito Juarez. We had the Aztec calendar, which we painted ourselves. And as we got older, we would go and leaflet, or we would even, my mother would take me on the bus with her when she would go on the bus to LA to precinct walk and support candidates, or to boycott the stores over there to tell our stories. So I learned at an early age to speak up and tell our story, because it was necessary to get supporters to not buy the grapes, or whatever, and to support the farm workers, because we couldn't do it on our own, and especially they kept bringing more and more strike breakers, right? So that was my education. And I grew up going to, many of us children that went there, we still know each other now as adults, and many have become leaders. I've been a labor organizer myself for the last 30 years. I was a mother for so many years and a wife, and then at 35 I started reorganizing again. That was Caesar's first anniversary of his passing. And let me see if I forgot anything. But I can tell you one thing, that before we had the union, before we actually got our first contracts, I don't ever remember going to the doctor. We always only used home remedies. Like I used to get sick from my tonsils, and my grandmother would swab me with, I don't know what it was, iodine or something. And we always had home remedies. But once we started organizing. Then we had a trailer out here, just a trailer, and that was our first clinic. And that's one of the trailers where I remember Ruth being a nurse there. Ruth will always be my forever nurse, because many farm workers got training, because it was this was our union, and we didn't really have professional people. So it's very touching to me, because it really changed our lives. But like Dr. Marion Moses, was one of the people I remember very well, and Dr. Murphy and Dr. Foote. They came here and gave their time. A couple of my sisters were delivered by them. Yeah. And I remember I was a young teenager now. I had grown up, and they talked to my mother, because my mother was a young mother at 16, but she was very old-fashioned, and they talked to her about family planning and birth control, like, because I was now coming out to 14, you know. Yeah. And so they opened up our parents' eyes to think differently. And the times that we spent with some of the volunteers really opened up our mind, because technically I only went to school till I was 15, and I got a GED at the high school Kunsi program in San Luis Obispo. Mm-hmm. And that's the only formal education I've ever had. But I do tell people that I got my political science degree from the United Farm Workers, where Cesar and Dolores were my professors, and my mother and my tias were my first teachers, and my neighbors, because this was all about the community. Yeah. And our community was very united. We were Chicanos, you know, Mexican Americans, and we're Mexicanos, but we were one community, and Filipinos. And there were a few Negritos still here in our community. There still are. Yeah. But we were all one community, all united together in our struggle. Yeah. Because at that time, when I was growing up, I do remember that in school, children that were monolingual Spanish speaking would get put like in special education, like if they were not intelligent. And they only didn't speak English, that's all. And so I used to have a free period where I was a tutor, and because I spoke like Pocha Spanish at the time, pero my grandma siempre nos hablaba en español, and like she would say, Yolanda, and I would say, what, grandma? ¿Cómo que what you say? Aquí se dice mande usted, you know? So she was very determined that we knew our culture and our language, and that our food, she goes, ay, ustedes con nopal en la cara, que ni sepan tu idioma, es una vergüenza, you know. Yeah. My grandmother was born in Bisbee, Arizona, but came from Sonora, Mexico. Mm-hmm. Her mother was from Sonora, Mexico, so she took a lot of pride in us knowing where we come from. Yeah. And so I remember that being very, I tutored a class that one of the teachers had monolingual Spanish speaking, and he didn't even speak Spanish. And his name was Mr. Stephen Mason, who I named one of my only son after, Stephen, because I invited him to, he would say, where do you go every day? He would see me looking at the door after school, like right at the end of period, for the Wega school to come and pick me up. They had a travel van, right? Uh-huh. That they would pick us kids up, and then we go to Early Mark, pick up the Early Mark kids, and come and help us do our homework and stuff. Uh-huh. And so I started telling him about the union and why and all of that.
I'm sorry, would they bring you to the 40 acres?
They would bring us to the little house over there. We didn't have 40 acres yet. Yes. This was before. We would go to the little house, and that was our
little school.
Mm-hmm. And so had books, and I remember reading like Bless Me Ultima, that I hear college students read, and I was like in 6th grade reading that book. But anyway, so I invited him to Safeway boycott, and then he met, and eventually he ended up taking over the Wega school when Gordon and Felicia got moved to La Paz, when the union moved to La Paz because of all the threats on Cesar's life. Yeah. And so anyhow, once he went to the Safeway boycott with us, since the teachers were they were all white, he got blackballed. He was no longer in the in crowd because he was now hanging out with us. But it was an education for him to know what he knew about unions. We didn't know about unions, you know, because now that I've been a labor organizer for many years, I know that, you know, professionals, teachers, nurses, doctors, attorneys, everybody has their own association or union, you know, and it's a right, you know. Yeah. But at that time, and it's funny because in 8th grade, I was selected to say a speech at a graduation. You know, you try out, people vote, whatever. But my speech was on Franklin Delano Roosevelt. So my speech was on Franklin Delano Roosevelt, but since I knew that my grandma would be so proud that, you know, we're graduating from 8th grade, I said, we need to do a bienvenido en español, you know, for our families. And they were like, no, we're not going to do it. But since I was already about organizing, I got a petition together and our parents signed it. So we ended up having it. But one of my friends said it, and I still said my speech on Franklin Delano Roosevelt. But I think it's very ironic, or it went full circle, because I learned that he's the one who had signed the National Labor Relations Act. and the Social Security and the Conservation Corps and put people back to work after the war and depression and so forth. And it's funny because as a labor organizer for the last 30 years, and I've worked with the National AFL-CIO, with the American Federation of Labor, Congress of Industrial Organizations. I was the National Western Regional Organizer. So I work with farm workers and hotel workers and machinists and, just every industry we would partner up with different unions. Yeah. So it's like what I learned as a young girl stayed with me, and especially healthcare and equitable wages and having dignity and respect on the job. And that's one thing that I've noticed in every industry and with workers that I work with. It's never even so much about the money, but everybody wants to be able to take care of their family and have health care. So it's the basics, and the respect and dignity. And I always say that the workers are the professionals because they do the work every day. And sometimes people get hired and they're more academic, or they have these degrees, but they don't know anything about the work, right? Yeah. So I tell workers, we need to, and I teach them about their contract empowerment, because I think if anything in the union, what I learned was empowerment, using your voice and standing up for yourself. Yeah. And I know that even now, like healthcare is so important. I sit on a board of, it's called Omni Family Health, and we're a federally funded healthcare center. And when I was on the board 10 years ago, we only had 13 clinics, and they were very poorly managed. So we got a new CEO, and I helped flip the board, and now we have 38 clinics in 4 counties where we serve. And they're counties where they don't have doctors, and we're not competing with anybody. We go where the need is at, like towns like Lindsay and Lost Hills, and places where they don't have, farm workers they don't have insurance, so we see everyone. If they're indigent, they have health care or not, and everyone's treated the same. And each facility is very, a very nice place. Each one has the same standard, and I feel very proud of that, because I know we're giving health care to families and children that otherwise would not have it. And my story is that my mother got sick at the young age of 35. I was 17, my sister was 14, and 9, and 6, and 4. And they didn't know what she had. It ended up being a terminal illness. Now we know it's leukoencephalopathy, vanishing white matter of the brain. But at that time they didn't know, and she didn't have health care. So she died within 5 years at the age of 40. And without us ever knowing, we prayed and we believed and we hoped, but none of that was going to change the outcome. And so now, fast forward, 40 years later.
Puedo preguntarle, ¿cuáles eran los síntomas que tenía su mamá? ¿Cómo comenzó a darse cuenta que estaba pasando algo?
Well, my mother started to have imbalance, like falling, and sometimes she'd be talking and just forget what she was saying, like having foggy brain. And some people thought that, she must have been drinking. She felt, and then the doctors at first had said she had schizophrenia, but my mother never drank, and she didn't smoke. Every once in a while, her and her sisters might have an Olympia. That was the beer at the time. But my mother, her thing was she'd have a Pepsi. That was, she just didn't drink. And so she started to lose her balance and everything, and then her brain. And actually, she was misdiagnosed, and she was put in Camarillo. And I went to go see her there. Like I said, I was a young girl, and I remember that being a very horrible experience. Because when I seen her, her tooth was broken, and she had bruises. They had stolen her wedding ring, and she didn't belong there. She was ill, and she was in a population that was very aggressive for her. So it was hard to get her out of there, because she had been committed, because they thought she had schizophrenia. But my cousin Freddie Chavez, who's an attorney, and Dolores Huerta made many calls, and we finally got her out of there, and we brought her here to a local convalescent home where she passed away. And the thing is, I used to walk, I'm trying to tell you how this union empowered us so much. I used to walk every day across, when I was a single mom, I was pregnant, and I think I was like 21, because my daughter was 6 months old when my mother passed away, and I was 22. But so I would walk across the bridge every day, and I would notice, because because I've lived here my whole life, that there was parts at the bridge where it's dirt, and then there's parts where it's a little bit of cement, and it's been that way still up to now. And in 2011, one of my neighbors, that a gentleman was in his mobility scooter. He lived across the street from my grandma, so I grew up knowing him my whole life, Mario Salamanca. Well, he was trying to go over the bridge in his mobility scooter, and a diesel truck ran over him because the bridge was non-ADA compliant. And so I do a lot of community work here, environmental work and community organizing, political campaigning, and so forth. And every time I come and I see that the bridge is around it is still the same, and we built a state-of-the-art clinic right across from the bridge on the other side, and the weeds were so high, and it was so I went to the city and said that it's not a safe pathway for the patients to get to the clinic. Like, why is that not managed? And I told them that person passed away there, and the bridge is still not ADA compliant. Like, what's going on? And they basically said, well, it's not our problem. And that's it. I said, oh, okay. So I came back and I did my research, and I found out, oh, it belongs to the Department of Transportation, the state. So I looked up on the website and I saw what they're supposed to be doing and have healthy pathways and da-da-da. So I went and I took pictures, and the first complaint was about the pathway to the clinic. And the second one is, if you drive by that freeway, look on any entrance, there's not even a way for a person in a wheelchair or a walker or a stroller to go down. So it's dangerous by the time you can even get across, right? And so now that my sister's in the wheelchair, I didn't get to that part yet, but I noticed those things, and so I took pictures, I filed a complaint, and then 6 months later, right away they came back with the first part and cleaned up the area where they needed to. And then they came back with my second complaint about non-ADA. So in 2028, they're going to allot $5.5 million to revamp the infrastructure of the bridge from County Line Road to Garces Highway and both sides of the freeway. So they're going to make it ADA compliant. So I know from the future, our community will have a safe pathway, and people will be able to walk and be safe. So, and I was going to say, so coming back now where my mother had no health care, we did not know why she died, and we lost our mother and father, because our father died a couple years later from diabetes and alcoholism. He just lost the will to live. So, we grew up without our parents, but my sister, like I said, she is going to be 51, so she was 47, and I was running the Central Labor Council, and I happened to be precinct walking, and so I went to one of my sister's house who lives here, and I asked her, oh, how's Barb? Because we don't see each other sometimes because we're busy working, and she was a Head Start teacher, and she said, oh, she hasn't been working for 6 months. I said, why? I don't know, something about her leg, but now the doctor's saying Parkinson's or MS. I was like, well, what is it? She goes, I don't know. And so I said, okay. So I went to see my sister right away, and she said that's what the doctor was telling her. I said, have they done any tests? She said, no. Make an appointment with your doctor. I'm going with you. So I went and got my mother's autopsy that said that whatever she had, that it could be genetic and hereditary. And it was so we went to the doctor, and then she was a specialist, and I asked her, I see that you're saying that my sister has multiple sclerosis or Parkinson's. I mean, how did you come to that conclusion? What diagnostic tests have you done? And she said to me, oh, the 3D test, whatever, is so expensive that, and I said, what? There is nothing more valuable than my sister's life. How did you arbitrarily decide that it's too expensive when my sister has 100% crossover because her husband is a correctional officer and she's a teacher, they're professionals and they have insurance. How good, my mother died of a terminal illness that's very aggressive and it could kill my sister. You'll be liable, And so then she made an appointment for us to go to Santa Barbara, but right away the doctor said it was beyond their scope. So then we went to Stanford and they did genetic testing, and within 4 months the results came back. So she had leukoencephalopathy, which is the leukodystrophy, and it's the vanishing white matter of the brain, so it kind of shorts out your brain, the circuit, to tell your body what to do. So actually that's what my mother had, because I had provided the autopsy, and they said that's exactly what she had, but they didn't know enough about it 40 years ago.
Yeah.
So it took 4 months to come back, and by that time, that disease is aggressive. My sister's in a wheelchair already by then. But in those 4 months, every night I would stay up and do research on the computer to find anything about anything, because at one time they thought it was Huntington-Chorea disease, which is still a brain illness. So I had found out something. There's some professor was giving a lecture about clinical bone marrow trials. And I said, whoa. So then, so I kept researching that. And so then when they came back with the results, when we went to get the results, once the doctor came and confirmed that, yes, it was. So then she left us alone for a minute. You know, we absorbed it, and my sister absorbed it. And so when she came back, I asked her, I have done some research and I found out that there's clinical bone marrow trials. How can we get one? How can we find out about it? We'll go wherever. And she told us that at the University of Minnesota, they had done 2. My sister would be the 3rd. So we went there for an evaluation. And since my sister was still young and healthy, she had always been healthy, not a drinker also. She ran every day. So she was a candidate for it because it was early on. She still, you know, there was not that much damage yet. And so one of my sisters, who's a veteran, and she was also a correctional officer, was 100% match. So my sister was her bone marrow donor. And my sister Barbara got her bone marrow transplant, and she's going on, let's see, 18, 19, 20, 21, 22. She's going on 5 years, and she's thriving. And she is in a wheelchair. She'll never be able to walk again, but she's alive, and she has a quality of life. And I didn't have to witness how I witnessed my mother's death. So my seeing what my mother went through helped me, even though I've never had any professional education, to know how to advocate and to not just take somebody's word for it and that my sister died. So, you know, I am now currently, I work for the California Democratic Party, because I feel that it's so important to educate our community about, you know, here locally in Porterville, our community went without water. People that lived out in the county for about 2.5 years, and even Ruth was affected where she lived. And yet Big Ag was digging deeper and deeper and deeper for the wells, getting the water they needed, while our community was paying so much for their electric bill because their wells were going and going and there's no water, and they had to go and take jugs and get jugs of water filled. I mean, really struggling, because why? Because we don't have representation that cares about our community and will advocate or represent us, the people that are elected. So everything that I learned here in the union, where the quality of our life, healthcare, education, you know, water, pesticides. Recently, I also belong to a volunteer group called the Delano Guardians, and when we were building our clinic, we found out about some plume, which is a toxic poison, a toxic substance that the cleaners used to throw down in the ground. And so we found out that it was by our clinic, and it wasn't divulged to us when we were starting to build it. So I found out because I know these community groups, and I told our CEO, so we stopped right away, and we did an environmental impact report. So we were safe because it wasn't under us, but it was like by us. But after that, our group continued, and it took us almost 9 years, and now we have a community advisory group, and I'm the chair of it. It's called Residents for a Clean Delano, and the state is part of it, and the city, and our group. And we had to push the city because the city knew about it and never wanted to do anything either. So we got rid of those leaders as well. But what we did is the state built these big, I can show you too, these big machines where they're sucking out that toxic, you know, and then, I mean, sure, it's going to be like carbon capture, right? But people won't be dying from cancer and other illnesses, or children who could be affected. So, you know, that's kind of the stuff that we do. And the people that I am, you know, that I work with are people who also have grown up in the union and have been leaders in the union, because we know it's up to us to advocate for our community. And I feel that healthcare is so critical and so important. And you know, like I said, I do sit on the board, and all of the clinics, I know that children can go there. I was sick recently. I got COVID for the very first time in the first week of August, And I was able to have a tele visit because I couldn't go in. They sent the medicine to my house, and I was like better in no time because I had the medication.
Yeah.
And so healthcare is so important, and healthcare is the difference between living and dying. And so many of our farm workers, by the time they retire, they can't plan, I'm going to go on a vacation. They don't have the money for it, having worked under such low wages. But not only that, now they need kidney dialysis because of all the years of not drinking water and not being able to go to the bathroom often because, because of their work. The pesticides. My uncle died too early. He had cancer of the thyroid. He was a night sprayer. He would spray the fields, right? And many times back in the day, they would spray the pesticides. And the people say, oh, es que van a echar la medicina. They would tell them it's medicine. But it was toxic poisoning for workers. So it's not medicine. They might have considered it medicine for the grapes, but not for the workers. So before the union, workers were not even considered about the effects to their health. Yeah. So, those are some of the reasons that I do what I do. And I think growing up in the union really taught us a lot. We used to go and sleep on the floor in the halls of churches. And in the morning, the ladies would make the burritos, and we'd be dispatched to our precincts. And people would say, why do you come to Los Angeles to walk precincts for candidates when you live in the Central Valley? Well, because Cesar and the union, the leadership of the union, understood that we needed to have people in Sacramento who would represent us and who cared about our community. And it resonated because even people in LA, we all come from the same, we've been migrant farm workers, but now after pushing for affirmative action, which the union was very instrumental in affirmative action, bilingual DMV, and also employment development to have EDD, unemployment for farm workers because they were also left out, and through that, also through our political action, we were able to get Governor Brown elected, who was the one who signed into law the Agricultural Labor Relations Act, since we were left out of the National Labor Relations Act and really didn't have rights, and why we were so abused by the sheriffs and the big ag and so forth. So, all of the history and the education, and really what I got out of the union was a CSEC with the attitude. It was like, yes, we can and we will, and it didn't matter, how much education we had or didn't have. We all were born equal with that potential to speak up and advocate for ourselves and our community. And I think, if anything, that's the most important lesson that I took and that I received from the people, of the great people whose shoulders I stand on, who were willing to sacrifice it all. And I feel very blessed and fortunate that my mother was courageous enough to be willing to stand with her coworkers and do what she needed to do. And I will tell you, coming full circle, is the other day I received a text message from my daughter, and she said, Mom, since you were the first one to take me to college on my first day with Irene in tow, I want you to know I just took Irene to college. So my daughter was a young mom. She had her baby 2 weeks after she graduated, and when she went to, I told her, having a baby is no excuse to not get an education. I paid for her books, her tuition. I bought her a van. I bought her a playpen, a stroller, everything. So on her first day, I took her and her little friend who was going to help her with the baby, and the baby was 2 weeks old, to her first day of college, and now the baby just went to college. She's 18, just graduated. Yeah. So my dream and my vision has come true because I always think about the day when Robert F. Kennedy was here at the 40 acres, and he said, one day when your children become doctors and lawyers and whatever they want to be, no one will be prouder than you. You will say, I did this. I marched with Cesar Chavez. So, now that there's so many and that's why it's so important that now that they had struck down affirmative action, and, we need to make sure that our children do have opportunities for education, because in our communities, parents, they would usually say, eso es pa gente que tiene dinero, because they didn't have extra money. You couldn't even, I was working at a very young age. I worked in the fields, and then I went to work at the fast food like Kentucky Fried Chicken. Every day after school, walk home, put my uniform on, go to work, or Wendy's, because I was not going to ask my parents for anything. I knew they didn't have that extra money, And another thing is, I saw the sacrifice of all the people, like when Caesar was fasting right there at the garage,
Yeah.
there was a little room where he slept, and he was so weak, but he was fasting so that we would commit to nonviolence, because he really took a lot of lessons from Gandhi, that nonviolence is our strength. People will listen better when they see the sacrifice you make and your commitment, than if you're just fighting back. They don't see the fighting back, they just see violence.
Yeah.
So Caesar sacrificed his life for us, and you know, we sang a lot of songs when we were young, like Caesar is our leader, we shall not be moved, or we're going to roll this union on, solidarity forever.
Yeah.
Those were the nursery rhymes that I grew up with, you know, and Niños Campesinos, Huelga en General. And, you know, I think I had a very full and rich life, and I feel very blessed. So, like I said, I was on the first march in 1966 with my mother and our family and our community to Sacramento to fight for our rights and talk about the injustices we were living through. And in 1994, I manned the main office. That was the first anniversary of Caesar's passing. And then recently, in 2022, last year, on my birthday, August 20th, I marched into Stockton with Martin Luther King III as we were marching on our way to Sacramento. And this birthday that just passed, when I turned 64, I was at the Democratic E-Board giving a speech about why it's important for us to vote and stuff. Yeah. So, you know, I feel very blessed, fortunate, and honored to be carrying on the work that started so many years ago. And I'm working right now with an intern whose great-grandparents, Tino and Jenny Vasquez, were leaders in our union. They always did fundraisers here at the 40 Acres, and they made the food and everything for dances to support the strikers and the boycotters. And so their granddaughter is the city council member, Veronica Vasquez, and she's running for county supervisor to make a difference in our community. And she's been very instrumental on the council. And now their great-granddaughter is an intern of the California Democratic Party and works with me. So I feel very proud to be mentoring and empowering other young women and young men, whoever it is that I have the opportunity to teach and to support in, you know, in this kind of work, because it's so important. And not very many people, you know, it takes a lot, and it's a lot of sacrifice.
Yes, definitely.
Wow.